Hi everyone, welcome back to my channel. My name is Katie Lee, CGC, and today is a super exciting episode of Fertility Friday because today I finally get to share something I've been working on creating for over the past month, maybe about 2 months now. And it's something that I really hope can help some of you that are experiencing miscarriages and just kind of don't know where to turn, or you're not sure how much of a evaluation you've had yet. A little bit about me. I'm a genetic counselor and I've worked in fertility for over the past 5 years. And then on top of that, I myself have gone through recurrent pregnancy loss with my partner for the past 2 years. So I thought after my first miscarriage and after my second miscarriage that I already knew quite a bit about recurrent pregnancy loss, but it turns out I had a lot to learn because there really is only a small subset of patients who are in fertility clinics because of recurrent pregnancy loss. It's thought that about 5% of couples or individuals who are attempting to conceive have 2 or more consecutive miscarriages, and it's only 1% of couples or individuals attempting conception that have 3 or more pregnancy losses. I myself have had 5 pregnancy losses at this point. I'd love to know what the statistics are on that. And I know there are some of you out there who've had, 8, 9, 10 or more pregnancy losses too. So 1%, it's pretty small, but in genetics, 1% is actually big. I know there's a lot of us out there who have gone through multiple miscarriages. So what I've made is 2 parts. One part is a worksheet to keep track of your recurrent pregnancy loss workup. It's right here because there are so many papers, especially if you end up switching OBGYNs or switching to IVF clinic like I have. I have just loads of records, like filing cabinets full of records. This is just like a tiny subset I just printed out as an example. So that's the first part, is this worksheet to keep track of, this worksheet to keep track of your workup and have everything all in one place. And then the second part is more of a handbook. It's a 5-page handbook that describes what each of the tests are and why they're recommended, how you would be treated for a condition if you do get a diagnosis with any of the tests, and what it means for you. So I'm super excited to have made this because I feel like there aren't a lot of resources where it's all in one place. And I hear from so many patients, they'll say, did I have a complete recurrent pregnancy loss panel? Or they'll tell me, yeah, I've done everything. And then when we start going through it, they've only done small pieces. And I think part of the problem is that most people who have a miscarriage or 2 or 3, they're followed by their OBGYN, especially at the beginning. And OBGYNs are fantastic, but they may not be up to date on the full workup that is recommended if you do have multiple miscarriages. So what I've based my recommendations off of for both of these packets is the American Society of Reproductive Medicine. And that's a group of IVF doctors or REs and scientists and researchers that work in the field of reproductive medicine. And they've published a committee opinion on what tests should be completed if a patient goes through multiple miscarriages and has that diagnosis of recurrent pregnancy loss. So that's what I based my workup checklist off of, but I also added a few things of my own, one especially that I think is very important here too. So I think this could be a fantastic tool if you're somebody who's just starting to explore what the cause of your miscarriages might have been and you don't know where to start. You're trying to advocate for yourself and ask your OBGYN for specific tests. Or the way I used it is to get organized and to keep track of different dates of testing, make sure you're up to date, and kind of have everything all in one place, because logging into all of the different patient portals, constantly resetting my password because I never know what it is, and then trying to keep both electronic records and some printed records, it's so easy to lose track of things. So I think this is easier. I'm going to show you a little bit of how I would envision using the checklist. And I think both of these go really well together. So you can kind of use the handbook, to learn a little bit more of each of the workup items and what they mean and how they're used. And then as you get those workup items completed and your results start coming back, you can keep track of this here. And then another idea I had is, as you're filling in information, you could shade in the boxes of any of the specific tests that came back abnormal or elevated. So I think I'm gonna do a few longer videos in the future where I go through each of the individual categories of workups or diagnoses that are recommended by ASRM. Like there's workup for antiphospholipid antibody syndrome. That's an immune condition that causes an increased risk for thrombosis or blood clotting, and therefore causes an increased risk for miscarriage. There's anatomical differences that you want to look for and be evaluated for. So a uterus that's shaped different than typical. There's hormonal or metabolic conditions like diabetes, high levels of prolactin, thyroid conditions like overactive or underactive thyroid, and then genetic conditions. Both the sperm source and egg source should be tested to see if they have chromosome rearrangements that could cause an increased risk for miscarriage. And then there's also genetic testing that can be performed on the tissue from the miscarriage. And that could give you an idea as to why a miscarriage happened. So that's what I've included here. And then on the side, I thought I'd include just a quick list of basic egg source workup items like AMH and FSH. Those are blood tests that can be used to give you an idea of your kind of level of fertility. Antral follicle count, how many follicles, which each hopefully contain an egg, are observed on an ultrasound. And other things like carrier screening, vitamin D. For the sperm source, things like a semen analysis, which measures the motility, the count, and the morphology of the sperm. And then lastly, some lifestyle factors. So things to keep in mind that we know can cause an increased risk for miscarriage. Things like cigarette smoking, having a healthy BMI, alcohol use, and so forth. So that's an idea of the workup worksheet that I created. And like I said, the way I'm planning to use it, and I've already filled out one of these, but I thought I'd just start anew for demonstration, is I've got my list of records here. So the first one, and I guess this is all going to be flipped, is my lupus anticoagulant. And it said I had no lupus anticoagulant detected. So I can just find that in my workup worksheet, and I'm going to write negative. And I'm going to write the date of the test, which was December 23rd, 2019. And then you can kind of just keep making your way down this checklist. And by the time you get to the end, you'll know whether you've completed the full recommended workup by ASRM or whether there's gaps. I did leave a bunch of blank spaces here, just because oftentimes the egg source will have some additional testing done that I may not have listed. So like the next thing I came to in my records was my blood type. So I can add that in. I'll write blood type. I'm A negative. It doesn't really matter what the date was because that will never change, but I'll write that in. And you can keep track of tests like things that might change that you might be treated for. Like if you are identified to have an elevated TSH or something like that where you're treated and then you have serial draws to see how the treatment affects your TSH level and see if you can be medically managed for your hypothyroidism or hyperthyroidism. You could include the results from multiple dates. So that's the workup. Let me know if you have any questions about it. I actually just started up an Etsy shop and put these 2 items on there. You can buy them individually. I thought just in case, you're just interested in the workup worksheet to keep organized, or you can buy them together and get them for a little bit cheaper if you buy both. So I'll include the link below. And what I'm planning to do, like I said before, is to go through each of the categories and spend a little bit more time in a different video explaining what the tests are, what they mean, and then what the follow-up would be. Also how common they are. But that all can be found right here in this packet that's really nicely organized. So if you want to get the information right away, go visit my shop, Katie Lee CGC at Etsy, and you can find this. Thanks for watching today, you guys. I hope you have a great, fantastic start to 2021.